So hello, everybody. My name is Ann Carol Braswell, and today I will be presenting on the outcomes in post-mastectomy tissue expansion following implementation of the COVID-19 mask mandate. So tissue expansion and before implant-based breast reconstruction is one of the most common breast reconstructive strategies in the United States, accounting for approximately 65% of all breast reconstructions. While generally regarded as safe, there are several associated complications. It is believed that surgical face masks provide a barrier between upper respiratory bacteria and surrounding personnel and a patient's wound, potentially decreasing the likelihood of an adverse outcome. UAB implemented a mask mandate in response to COVID-19 that required all employees, patients, and visitors to wear a mask or face covering inside all UAB medicine facilities at all times. And the purpose of this study was to understand the effects of mandatory COVID-19 masking on post-mastectomy tissue expansion complications done in the outpatient setting. So we completed an IRB retrospective review on all female patients who underwent unilateral or bilateral tissue expansion following mastectomy at our tertiary care center in 2017, which would have been prior to the mandatory COVID-19 mask mandate, and then 2021, which would be following the implementation of the mandate. And the variables we included were patient demographics, procedure information, and post-operative outcomes. So for our results, overall, the cohort had an average age of 51 years, 78% was white, 19% Black, and 3% other. There was no significant difference in age at procedure, BMI, smoking status, or history of diabetes between the two groups. We found that there was no difference in who used drains, the pre-mask mandate group or the post-mask mandate group. Drain output was the same in both groups as well. There was a significantly lower rate of minor complication after implementation of the mandate. There was also a lower rate of major complication after the mandate. However, this difference was not significant. And for this study, a major complication was defined as any post-operative complication that did require a procedure to correct, such as like hematoma, seroma, something like that, while a minor complication was that which was corrected successfully without a procedure, example, erythema. So to conclude, despite similar demographics in our pre-mask mandate and post-mask mandate groups, there was a significantly lower rate of minor complication after the implementation of the mask mandate. We will be conducting a larger, more extensive review to further analyze these results. And I'll take any questions.